Hello friends, how are you guys? I hope you are all fine and doing well. Today in this video we are going to discuss some MCQs related to pharmacy subjects. So stay with me, thank you. Our first MCQ is microbial resistance to penicillin G is there because of the following. In this MCQ we are asked about the mechanism of microbial resistance to penicillin G, meaning that through which mechanism microbes develop their resistance to penicillin G. So we have 5 options from which we have to select the correct one. Option A is production of beta lactamases. B is decreased permeability to the drug. C, active removal of the drug through efflux pump. The D option is altered penicillin binding proteins, and the last option is all of the above. So in this case, resistance to penicillin G is there because of this altered penicillin binding proteins. Actually the microbes they have penicillin binding proteins that are not as they should be. They are altered. So in this case our antibiotic penicillin G will not be able to bind effectively to this protein and exert its effect. So the correct option is D. Now the second MCQ, MRSA resistance. MRSA means methicillin resistant Staphylococcus aureus. So in this bacteria, resistance to most commercially available beta-lactam antibiotics is because of the again these options are there: production of beta-lactamases, decreased permeability to the drug, active removal of drug through efflux pump, altered penicillin binding proteins, and last option all of the above. So the correct option is again altered penicillin binding proteins. MRSA resistance is actually due to altered penicillin binding proteins. So D is the correct option. Now the third MCQ in this set is Klebsiella pneumoniae presents resistance to antibiotics through the following mechanism: a production of beta lactamases, decreased permeability to the drug, active removal of drug through efflux pump, altered penicillin binding proteins, all of the above. So in this case the correct option is active removal of drug through efflux pump. Actually Klebsiella pneumoniae presents resistance to antibiotics through the mechanism of active removal of drug through efflux pump. This mechanism is specific to Klebsiella pneumoniae, so we have to actually remember this by heart. So now moving to the fourth MCQs, Pseudomonas aeruginosa presents resistance to antibiotics through the following mechanism. Again these options are there. These are all actually pharmacology MCQs, and if you have covered the antibiotic section of pharmacology, then you will be easily able to answer these questions. So again in this MCQ we are asked about the resistance mechanism of Pseudomonas aeruginosa to our antibiotics. So these options are there, and the correct option in this is decreased permeability to the drug. Actually this bacteria called Pseudomonas aeruginosa, it actually resists the entry of the antibiotic into its cell. So the correct option is B, which is decreased permeability to the drug. Now moving on to the fifth MCQ of this video: which one of the following penicillins particularly have the potential to cause acute interstitial nephritis and for that reason no longer used clinically. Actually, among the following penicillins, one is such that has the potential to cause acute interstitial nephritis. We have to identify that penicillin. So options are there: dicloxacillin, carbenicillin, methicillin, ticarcillin, fenbenicillin, and the correct option is methicillin. So now we know which penicillin causes acute interstitial nephritis. The correct answer is C, methicillin. Now moving on to the sixth MCQ, which one of the following fluoroquinolones does not need dosage adjustment in case of renal impairment? And this can be given as such in renal dysfunction. So options are there: ciprofloxacin, moxifloxacin, delafloxacin, ofloxacin, and gemifloxacin. So the correct option in these are in these fluoroquinolones, moxifloxacin is the one that can be given in renally impaired patients because it is not excreted through that route, so it can be safely given. So the correct option is B. Now moving on to the next MCQ, all of the following fluoroquinolones are primarily excreted in urine except. So options are there again: ciprofloxacin, levofloxacin, norfloxacin, moxifloxacin, and gemifloxacin. As we have learned in the previous MCQ that the fluoroquinolone that does not need dosage adjustment in case of renal impairment, because this fluoroquinolone is not excreted via renal route, so we can give this fluoroquinolone in renally impaired patient. And from the sixth MCQ, the seventh one can be solved if we know the answer to the sixth MCQ. So the fluoroquinolone that is primarily excreted in urine are all of the below except moxifloxacin. Moxifloxacin is not excreted primarily in urine, so the correct option is moxifloxacin. Now moving on to the 8th MCQ, which of the following macrolide antibiotics has the longest half-life of all? One is erythromycin, clarithromycin, azithromycin, and telithromycin. These are all macrolide antibiotics, and among them there is one that has the longest half-life of the four, and that is C. So the option C is the correct option. Azithromycin has the longest half-life of all macrolide antibiotics. Now moving on to the next one, the following fluoroquinolone is available as an oral formulation only. We have one fluoroquinolone among the below given options that is available in oral formulation only. So options are gemifloxacin, levofloxacin, norfloxacin, moxifloxacin, and delafloxacin. The correct option is gemifloxacin. It is available only in oral formulation. So now we know that gemifloxacin is available, that is a fluoroquinolone, and it is available only in oral formulation. That is not in any other formulation like IV or IM or something else. So now the last MCQ of this video, the following is a first line therapy for community acquired pneumonia, which is also abbreviated as KAPS, community acquired pneumonia. So what is the first line therapy for community acquired pneumonia? Options are gemifloxacin, levofloxacin, norfloxacin, moxifloxacin, and delafloxacin. Now the correct option is B, levofloxacin. Levofloxacin is the first line therapy for community acquired pneumonia. This was all for now. Thanks for watching, and please subscribe to my channel if you want to get notified for more upcoming videos like these. So thank you.